If your skin is changing in strange or unexpected ways after 60, like dark patches, rashes, or constant itching, it might be more than aging. It could be your kidneys crying for help. These skin signs of kidney disease are easy to overlook, but they could be your body's first alarm bell that something deeper is wrong. Your skin is more than just a protective layer. It's a mirror to your internal health, especially your kidneys. These two fist-sized organs filter over 50 gallons of blood a day, removing waste and excess fluid. But when kidney function starts to fail, a condition known as chronic kidney disease, or CKD, your skin often reveals the damage first. And here's what's alarming. According to the National Kidney Foundation, more than 1 million American seniors have kidney disease, but 90% don't know it. For seniors, that risk is even higher. In this video, I'll walk you through 7 skin signs of kidney disease you should never ignore. We'll cover everything from itchy skin CKD to nail changes kidney disease, and in one later section, I'll reveal the most overlooked sign that nearly everyone mistakes for aging. Don't miss it. Before we begin, make sure to subscribe and like this video so you don't miss more valuable health tips designed specifically for seniors like you. Let's dive in. Skin sign number 1. Dry and itchy skin. Have you been scratching more than usual lately or noticed your skin feels like sandpaper, no matter how much lotion you apply? This isn't just dry winter air or aging skin. In many cases, dry skin and kidney failure is one of the first and most common CKD skin symptoms. Here's why. Healthy kidneys remove waste and balance key minerals like phosphorus and calcium in your blood. But when kidney function declines, those wastes start building up, causing inflammation beneath the skin, which leads to that frustrating dryness and non-stop itching. This is a classic CKD skin symptom known as Uremic pruritus. According to the National Kidney Foundation, up to 40% of people with moderate to severe chronic kidney disease suffer from persistent itching, and it often appears before other major symptoms like swelling or fatigue. Take Mr. Charles, a 70-year-old retiree from Arizona. He spent months applying lotion for his dry, itchy skin, blaming the desert air. But during a routine checkup, his doctor found elevated creatinine levels. The cause? Stage 3 chronic kidney disease. Thankfully, he caught it early and started treatment. So if your skin suddenly feels dry, irritated, or you're scratching more than usual, please don't ignore it. Talk to your doctor and ask for a kidney function test. Catching CKD early can protect more than just your skin. It can save your life. And this is only the beginning. We still have 6 more warning signs to uncover, some far less obvious than this one. So keep watching and check each one carefully. You might spot something you've been missing. Skin sign number 2. Rash and bumps. If dry, itchy skin is the body whispering that something's wrong with your kidneys, then a sudden skin rash or strange bumps is starting to speak louder. When the kidneys lose function, they can no longer filter waste properly. These unfiltered toxins irritate your skin from the inside out, leading to red patches, tiny fluid-filled bumps, or raised areas that look like allergic reactions but aren't. As Harvard Health Publishing explains, uremic toxins in patients with CKD can trigger inflammatory responses in the skin, often misdiagnosed as dermatitis or hives. Think of your blood like water flowing through a filter. When the filter fails, the water turns murky, and in your body, that murk often surfaces through your skin. A powerful example is Marcia, a 70-year-old woman who started noticing clusters of red welts around her stomach and thighs. She thought it was heat rash, but after trying antihistamines and steroid creams with no relief, her doctor ordered labs and found elevated BUN and phosphorus levels. The diagnosis: chronic kidney disease, stage 4. So if you notice rashes that persist, spread, or return again and again, don't just treat the surface. Ask your doctor to test your creatinine, eGFR, and phosphorus levels. Have you ever had a persistent rash that didn't respond to creams? Tell us below. Your story might help someone catch kidney damage early. Skin sign number 3. Skin color changes. Have you looked in the mirror lately and felt like your skin looks off? Not just wrinkled or dry, but pale, grayish, or even slightly yellow. This isn't just a cosmetic issue. It could be your kidneys calling for help. It was a small comment from her granddaughter that made 73-year-old Mrs. Janice stop and look in the mirror. "Grandma, why is your face kind of gray?" Janice had noticed it too. Her skin was duller, almost ashen, especially around her mouth and eyes. At first, she thought it was just age. But routine labs showed something more serious. Her kidney function had dropped dramatically. Skin color changes in kidney disease aren't just cosmetic. When kidneys lose their ability to filter waste, toxins accumulate in the blood. Over time, this affects the pigmentation of your skin, often leading to paleness, grayish tints, or even yellow-brown patches. It's especially common in older adults whose CKD has gone undiagnosed. But here's what's happening inside. Kidney failure causes anemia, which makes the skin pale, while retained pigments in the blood cause yellowish or gray hues. It's your body telling you that something is deeply out of balance. A study published in the American Journal of Kidney Diseases found that over 30% of patients with advanced CKD show signs of visible skin discoloration, often mistaken for normal aging. Next, we'll talk about the one symptom that reveals itself slowly, but it's one of the most dangerous if missed. You won't want to overlook what's coming next. Skin sign number 4. Swelling and puffiness, edema. If skin color changes reflect the kidney's inability to keep your blood clean, then swelling and puffiness reveal the struggle to maintain fluid balance, and it's a sign you can often see in the mirror or feel in your shoes. Mr. Alvin, a 75-year-old widower from North Carolina. For months, he woke up with puffy eyes and stiff hands. By afternoon, his ankles felt tight and heavy, leaving deep marks from his socks. He thought it was just poor circulation from aging, but after routine blood work, his doctor discovered elevated creatinine and low albumin levels, classic signs of moderate kidney dysfunction. When kidneys begin to fail, they can't remove excess sodium and water from the body. That extra fluid leaks into surrounding tissue, especially in the lower legs, hands, and around the eyes. It's a condition known as edema, and it's one of the most visible chronic kidney disease symptoms in older adults. According to Harvard Health Publishing, fluid retention is an early red flag of kidney problems, often misattributed to heart issues, inactivity, or diet. But unlike normal puffiness, kidney-related swelling doesn't go away easily and often returns daily. And if your shoes feel snug by evening or your face looks puffier than usual when you glance in the mirror, don't ignore it. Get a full kidney health check, including your creatinine levels, eGFR, and blood albumin. It's a simple test, but it could catch kidney disease before it progresses. Skin sign number 5. Abdominal lump. Kidney disease often hides deep inside the body, but sometimes it makes itself known right under your skin. That's exactly what happened to Gerald, a 74-year-old retired bus driver. One morning, while applying lotion after his shower, he felt a firm, round bump near the side of his belly just below the ribs. It didn't hurt, but it felt strange. When he mentioned it to his doctor, they scheduled imaging and discovered his left kidney was enlarged due to multiple cysts. Gerald had unknowingly lived with polycystic kidney disease for years. An abdominal lump or bulge, particularly on your sides, lower back, or just below the ribs, can sometimes be a subtle kidney damage symptom after 60. It's rare, but serious. As the National Kidney Foundation explains, conditions like cystic kidney disease or hydronephrosis can cause the kidney to enlarge, and in some cases, this enlargement can be felt as a lump beneath the skin, especially in thinner individuals. While not every lump is dangerous, a mass that feels firm, doesn't move, or gradually increases in size should never be ignored. So if you ever come across a firm bulge in your side or lower belly that wasn't there before, don't wait it out or assume it's harmless. It's worth having it checked. A quick imaging test could reveal what's happening beneath the surface, and help you catch a kidney issue before it becomes serious. Take a moment after this video, gently press along the sides of your lower ribs and belly. Feel anything unusual? Leave a comment below and let me know. I read every story, and yours might help someone else. Skin sign number 6. Calcium deposits. For Patricia, a 69-year-old former pianist, the first sign something was wrong wasn't painted, was the quiet return of something she hadn't felt in decades. Small, hard nodules beneath the skin on her arms. At first, she thought they were cysts or just stiff tissue from age. But as they spread toward her elbows and thighs, her doctor ran tests and the culprit was clear. Mineral buildup caused by declining kidney function. This condition, called calcinosis acute, occurs when excess calcium and phosphate in the bloodstream begin to crystallize and settle into soft tissues, especially under the skin. It's one of the less common but medically significant CKD skin symptoms, and it's especially linked to advanced stages of chronic kidney disease where mineral balance is disrupted. According to a 2021 report in the Clinical Kidney Journal, calcium deposits occur in up to 20% of people with end-stage renal disease, often appearing as firm, white, or yellowish bumps near joints or under the skin of arms, legs, or buttocks. These deposits can feel like pebbles, and over time, they may become tender, inflamed, or even break through the skin, posing risks for infection and poor wound healing. Now, before we dive into the final sign, here's a little surprise. It doesn't show up on your skin at all. It shows up on your nails, and you may be wearing the warning without even realizing it. Stay tuned. Skin sign number 7. Nail changes. Among all the signs we've talked about, this one often goes unnoticed, even though it's right in front of you every day. Mrs. Helen, a 71-year-old retired school principal, first noticed her nails turning dull and brittle. Then, she developed a strange two-tone appearance. The bottom of her nails was pale, almost white, while the top half became a deeper reddish brown. At first, she chalked it up to aging, but when she showed her hands during a routine checkup, her doctor grew concerned. Blood tests revealed she had stage 4 chronic kidney disease. These changed, especially what's known as half-and-half nail scar, more than just cosmetic. They're caused by a combination of anemia, low protein levels, and uremic waste buildup that affects blood flow under the nail bed. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, 40% of CKD patients experience nail abnormalities. A 2022 study in nephrology dialysis transplantation found that patients with declining kidney function, eGFR 45, were nearly twice as likely to show nail discoloration or splitting than those with normal kidney labs. These early changes may appear months before more obvious symptoms like fatigue or swelling. So take a moment to look at your hands. Are your nails unusually pale, yellow, brittle, or split down the middle? Do you see 2 distinct color bands? If so, it's time to talk to your doctor and request a full kidney panel, especially your eGFR and hemoglobin levels. If your nails are telling a different story lately, don't brush it off. This may be your body's final visible warning. And now that you've seen all 7 signs, take a moment to reflect. Is your skin trying to tell you something deeper? We covered 7 skin signs of kidney disease that are often ignored, but could be the earliest warnings your kidneys are struggling. From itchy skin to calcium deposits, from color changes to nail abnormalities, each one is a signal that something deeper may be going on. If you're over 60, watching for these kidney damage symptoms isn't just smart, it's essential. The sooner you notice them, the sooner you can take action. Even small changes, when spotted early, can help slow the progression of chronic kidney disease. My advice? Check in with your doctor regularly. If you've experienced any of these signs, don't hesitate to speak up. A simple blood or urine test could make all the difference. To maintain kidney health, it's crucial to stay active, eat a balanced diet, stay hydrated, and avoid excessive salt and processed foods. Small changes in your daily habits can significantly improve your kidney function and overall well-being. And if you found this helpful, do me a favor, click subscribe, hit the notification bell, and give this video a like. That way, you'll never miss important health tips made specifically for seniors like you. Thanks for watching, and I'll see you in the next one. It dives into the drinking habits that can protect your kidneys every single day.